Dr. Soin, I wanted to get your thoughts into this conversation as well. Fungal infections, one of the key reasons Dr. Kohli did point out is because of the misuse of medications which are so easily available over the counter. And that's one of the key topics, the topic of misuse of topical steroids as well. Give us a sense in terms of what you've noticed in your practice when it comes to this kind of misuse.
I think you're absolutely right. Dr. Kohli was right. And what happens is I think a lot of people will go to a pharmacist and get a medicine for what they perceive as a skin ailment. And sometimes that could also result in them getting a topical steroid there. So, and if you use a topical steroid for a fungal infection, it changes the whole nature of the fungal infection and makes it's not discernible as to what the original condition was. Topical steroids is something which cannot be just given indiscriminately. It has to be prescribed by a dermatologist. Because of the side effects, apart from just the side effects, it changes the nature of the disease condition. There's been skin thinning, there's all these red little lines on faces, which is telangiectasia, where the capillaries become very prominent. You will see stretch marks on the body sometimes, or even on areas like the neck or the face where they've used. So it's really important, like Dr. Kohli said, to create awareness about not using steroids except under dermatological supervision.
How serious, Dr. Soin, can a fungal infection get, and what is the best way to treat it?
Fungal infections are treated most by a topical cream and an oral medicine, an oral antifungal. I mean, they're never serious enough, but they can get worse if you don't treat it. And also sometimes if people are immunocompromised, it can get really bad.
Topical steroids, what else are they used for? Dr. Soin did mention whitening or lightening of the skin. And that is a prevalent cultural issue that we face in India as well. Do you see that in your practice, that people want to lighten their skin? They have misused steroids for that?
The obsession for white skin. And that leads to people using these triple combination creams, which usually contain a steroid and another very popular element known as hydroquinone. Now, hydroquinone, if used correctly under the supervision of a dermatologist, can work for your benefit. But when it is misused, it can actually lead to a major skin problem, which is very difficult to treat. And we see a lot of these patients who have been using these fairness creams, which are a combination of the steroid with this hydroquinone, which leads to not only thinning of your skin, but an ashy kind of dermatosis, which gives you this gray skin look. And by the time they come to you, the damage is actually to such an extent that it's almost impossible to repair it completely. So the barrier of the skin is lost because your steroid is thinning your skin. And over time, it's also over-sensitizing you to the sun. So more than the benefit, it's actually causing you more damage because you're getting more prone to UV damage when you're using steroid long-term on the face.
Dr. Soin, what do you tell your patients when they come to you and they say that, my daughter has to get married, I need to lighten her skin?
I feel like it's getting better, especially in the new Gen X. Everybody is quite confident about how they look. And that whole thing about skin lightening has moved on to skin brightening, I think more. That for me is a positive change, especially in a certain section of people now. So I feel people do come in, and they do come in for skin brightening, texture improvement treatments, and, improvement of pigmentation, which is all fair, which is fine. But I think less so now, I want to say over the last 4, 5, 6 years, especially, than before. Earlier, lightening was, it was horrifying sometimes to even have people, guys get their fiancés in to, talk about skin lightening. So I think now I feel there's a lot of pride in us